Yeah, after many decades of running hospitals and developing cardiovascular service lines, I became a patient about 3 years ago with what we call an ST segment elevation. I was having a heart attack, and it happened to be during a cardiology meeting. So I had a room full of cardiologists, which is seemingly kind of convenient. Developed some chest pain and excused myself from the meeting and went to an adjacent office, and ended up texting one of them and telling him I was having some crushing chest pain. And as he dashed over to the office, everything resolved. The pain went away, but he said, we better take care of this right now. So came here to my own program. This is one of those things that makes you feel really good when your own program works well. Came here to the cardiovascular intensive care unit, and during preparation as a patient, they did an EKG and discovered, in fact, I was having a heart attack actively right then. But when I emerged from this, I emerged with a lot of mental notes about the things that I wanted to see done maybe a little bit differently, or the messages I wanted to convey to other people who have similar circumstances. And so that's been really, really of high utility for me. And the one thing we want to do in designing healthcare delivery processes is really be attuned to what the patient's experience is. And we spend a lot of time and money trying to learn about patient experience. But at the end of the day, there's only a few things we can measure. We measure how clean it is and whether or not people smile, whether or not people are concerned for the same kinds of safety issues as we are, like our medications and what we're being given and why we're being given it, and for the attentiveness where it's appropriate of our physician, and for good food. So that, those things, for most people, that's what we can assess. But I think when you've been a patient, the passion that emerges subsequent to being cared for is really a little more finely tuned. So when I approach this, if we think about emotional intelligence, and I'm really serious with my managerial staff and my own staff, that passion needs to be applied in a very concerted manner. And we only come here every day for one thing, only one thing, and that's to take care of patients. And I think remaining grounded in that and staying passionate about the care, maybe we forget about the trivial issues, pay more attention to the individual we're caring for.